Come in.
Hi, my name is Latrice. I'm your nurse today, and I'm here to do a health assessment on you, a head to toe. Is that possible today?
Yes.
Okay. What's your name and date of birth, sir?
Nat Turner, 4/18/71.
Okay. Before we get started, I have 3 questions or so I need to ask. Is that possible?
Yes.
Okay. Who's the president of the United States?
Joe Biden.
And what year are we in?
2022.
And where are we?
In my house.
Okay, thank you. So, patient is alert and oriented, ×3, person, place, and time. He has good posture, speech is clear, and no noticeable issues at this time. We're starting off with the head assessment, and with the head assessment comes with 12 cranial nerves, and I need to review these with you. Are you okay though? Are you having pain or any discomfort before we start?
No, I'm good.
Okay, thank you. Hand sanitizer, okay. So now, can you please close your eyes? And when I take my hand and put it across your nose, you tell me what you smell.
Rose.
Okay, that's cranial nerve 1. Cranial nerve 2, can you take your hand and cover your right eye? And on your right side, when you see my hand come into your view, say I see it.
I see it.
Okay, and we'll do the same thing on the left side. Hand come into view to let me know you see it.
I see it.
Okay, that's cranial nerve 3. Cranial nerve 4 and 6, it also deals with eye movement. I have a light pen here. I'll take this pen and I'll focus into his eyes. Can you look straight ahead? Okay, and his pupils are equally round and reactive to light accommodation. No issues noted. So with 4 and 5, I need you to also, no, 4, this 3, 4, and 6, I need you to look at the tip of this pen and only at the tip with your eyes, but don't move your head. Follow the pen. Okay? And eye movement within range, no issues noted with the eyes. Can you please open your mouth? Okay, stick your tongue out. Say ah.
Ah.
Okay. Can you smile? Can you frown? Can you raise your eyebrows? Okay, that assesses cranial nerve 5 and 7. 8, I need you to close your eyes. I'm going to take my hand and snap. You tell me where you hear the sound coming from.
Right. Left. Right. Right. Left. Left.
Okay, that's cranial nerve 8. Just checking for his hearing, and that's intact as well. Cranial nerve 9, 10, and 11. Also 9, 10, and 12. Can you say ah? Okay. Open your mouth. No issues noticed. Take your tongue out again. Move it side to side again. In and out. Okay. And that deals with cranial 9, 10, and 12. Cranial nerve 11. I'm going to take my hands, touch your shoulder, and I'm going to press down and you push up as I press down. Okay. Take your hand, lay it on my face, push my hand here. Okay. Thank you. That's the cranial nerve 1 through 12. No issues noted with the nerves. From 1 through 12, everything seems to be intact. Now, moving right along, I'm going to assess his eyes, his ears, his nose, his mouth, his throat. And assessing his eyes, well, I have a few questions. Do you have any wear glasses, contacts?
No.
Any eye issues?
No.
Drainage from your eyes?
No.
Have you had the pink eye?
No.
Okay. What about from your ears? Any drainage ever come out your ears?
No.
Bleeding? Nothing?
No.
What about your nose?
No.
And your mouth, it's no drainage?
Not at all.
Okay. Can you open your eyes and look straight ahead? Open your mouth again. Okay. Okay. And now that was the assessment of his eyes. The sclera is white, no issues noted. With those, his nose, no drainage noted. Um, his ears, no drainage was also noted, and his mouth is fine, no sore throat, no issues noted. His head to be, everything is intact, in place, no issues noted. The next assessment will be his neck. I will assess and I will be checking his lymph nodes. And as we go, I'll check submental, submandible, submandibular, preorcular, postocular, occipital, clavicle, superficial clavicle, and tonsillar. All of that was intact, no issues noted, no swelling, no drainage, no mass noted, small palpable areas noted to the site. Now, is it possible that I can listen to your lung sounds?
Yes.
Okay. Listening to your lung sounds, do you have any histories of shortness of breath?
No.
No respiratory issues?
No.
Do you smoke?
No.
Okay. Every time I lay it, you take a deep breath for me. Okay, the interior aspect of his lung sounds are clear, no respiration issues, respirations, heart rate noted at 69, even, unlabored. That was the interior aspect. The posterior aspect, I'll do the same. Turn yourself around this way. Posterior aspect of his lung sounds are all clear, unlabored, easy breathing, no runkles, no crackles, and no wheezing noted. Now, is it possible I can listen to your heart sound?
Yes.
Okay. Aortic, pulmonic, herbs, tricuspid, mitral. Okay. Now those were the heart sounds. Everything was intact. No issues was noted upon assessment. Is it possible I can see your fingers? Checking for the capillary refills. And what I do is I'll squeeze the tip of your fingers and let go and try to see how the blood return. And it's +2 for your fingers. I'll also be assessing your pulse areas to check your temporal, carotid, radial, brachial, I'm sorry. Radial, ulnar, femoral, popliteal, posterior tibia, and doralis pedis or pedal pulse at the top. Okay, that completes that portion of the assessment. Now, is it possible that I can have you to lay down? With this assessment here, we'll be checking the abdomen. I wanted to listen to his bowel sounds. And when we start, do you have any pain?
No.
When was your last bowel movement?
Earlier today.
Okay. Was it soft form? It was okay?
Yeah, it was okay.
All right. So we'll be starting off with the right lower lobe. Up to the right upper lobe. Left upper lobe. Right lower lobe. Okay. Then we'll do some percussions. Okay, you can sit up. I wanted to also, which was what I should have did, was check for the lungs expansion, and I should have had him to do some things, so I forgot it, but the assessment is not over, so we're gonna implement it now. This is a part of the lung assessment. I need you to say 99.
99. 99. 99.
Okay, and then I'll come and check for the lung expansion. Turn around so the camera can see. Okay. Okay. That was a part of the lung expansion. When I listened for the lung sounds, I should have followed through with that and then went to the pulse areas to check the capillary refills, but it's done. Thank you. Now, also, last but not least, can you take your arms and hold them out? Okay. Can you wind them forward? Can you wind them backwards? Okay. Put them down to your side. Can you turn your head left, right, up, right, up, down, up, down. Can you please stand up? Okay. Can you walk towards me? Okay. Can you walk back? Okay. Now, this concludes my assessment. My name is Latrice. Sir, are you having any issues of pain right now, or
No.
are you okay? Everything is good? You're comfortable?
Yes.
Okay. This concludes my assessment, and my name is Latrice. We did a head-to-toe assessment. Thank you.